and operate is last resort. These dogs are having more operations than Michael Jackson. I don't understand it. That'll be 1,000, that'll be 50, another 60, 150, 170. Do I look like the head of a cartel drug operation? I don't earn that sort of money. Little bit of a controversial one. Come on to talk about tick, worm and flea prevention. And I often think this is a great discussion. It's quite a controversial one and everybody's got really strong differing opinions on it. I tend to not bother talking about things like this online because we are in quite a woke society at the moment when it comes to controversial subjects, but also it's a grey area with experts like dog groomers who have had years and years of experience, and myself of 14 years of owning large packs of dogs of multiple breeds, and also people you find old school in the professional canine industry, if you want to call it that. I'm talking about old school breeders, not the new lot that are churning out mixed breed mongrels for money for £2,000, £3,000, some of them. I'm talking about people from old school that have got a real long history of on the ground actual factual experience. We differ from textbook vets and corporate vets and, let's be honest, a high percentage of pet owners that are going to get a vet's opinion over an industry expert like a groomer or a breeder or somebody that's owned packs of dogs, you know, people that are in that kind of profession. And I can understand that. And also the veterinary industry is regulated. Vets are allowed to tell you whatever they want to tell you. We're not actually regulated, so there's a grey area as to what we can and can't say. So what I will say going forward in this conversation is this is not me telling you what's right or wrong or what you should do. This is simply, disclaimer, just my opinion, and it's just for listening. It's quite interesting, the cost of vets these days. I've been on radio many times in the past, I think probably pre-2020, talking about the cost of dog ownership, the cost of vets, the cost you need to research to commit before you get a dog. And I was the first one to run my mouth and say, if you can't afford a dog, don't get one. Plan for your change of circumstances, that sort of thing. And boy, do I shut my mouth now about affordability when it comes to dog ownership. We have gone really, really rapidly from annual vaccines being around, well, they weren't around, for me they were £17.50 per vaccine, an annual vaccine. And they jumped from £17.50 to £64.50. In 1 year, they went from, if you heard that, £17.50 to £64.50 per jab the next year. That's like a ridiculous increase. I don't know an industry that's increased a product or a service that much in 12 months. Since then, the following year, it went from 64 to 73.30 to be exact. So £17.50 times 2 when you're on your third cycle of jabs, because you have one set of jabs 1 year and then you have your double jabs every 3 years. You can imagine the price of that. Now, I'm not sucked in to these monthly clubs that a lot of people are sucked into with their corporate vets. They're just not of benefit to me. I can understand why these monthly clubs are beneficial to people who don't have a great knowledge or any knowledge, some people, of health and hygiene of the dog, and they just want to make sure their dog has a once over. And a lot of times the vets suck you in by giving you percentage off of the operations. A lot of times people will go for their annual checkup or this monthly club they're in, and that's when you, as far as you're concerned as a pet owner, there's nothing wrong with your dog, and all of a sudden, oh, got a bit of a wonky hit knee here, we need a knee operation. straight away you're just getting your checkbook out. Well, probably not in 2025 you're not. You're just paying on Apple Pay. It shows you how old I am, checkbook. But a lot of the time you're sucked in. Immediately you're going to want to pay to keep your dog healthy. Oh, my dog needs an operation, and your dog's bounding around, there's nothing wrong with its knee, you know. And a lot of the time they'll diagnose that without actually scanning your dog. But you're going to listen to your vet. Then there's the other thing when there is nothing wrong with your dog, or there is something wrong with your dog, should I say, and then they love a scan when it's unnecessary, when there's symptomatic stuff that's a bit obvious, and I think the service that's given to you is way over the top. But for me, keeping it on subject, because this is such a wide, controversial subject, keeping it on the subject of ticks and fleas and worming, I don't do that. I never have. I always, if there is a problem with a tick, I know how to remove one. Don't try that at home yourself unless you've been trained professionally, or canine first aid, that sort of thing. Tick needs to be removed properly, and you need to actually kill the tick as well. Make sure that you don't take the head off in the dog, and there's, sometimes it might have caused infection in the skin. You need to know what you're doing with that. Fleas, I treat myself with the correct shampoo. It needs to be left on for 10 to 15 minutes and put on properly onto the body for it to actually work. And then I fumigate whatever scenario I'm in. So if it was in the house, I'd do a fumigation spray, wash all the beds, all that kind of thing. Fleas, unless you're living with a lot of cats, unless you are, you have a high amount of hedgehogs running around in your garden, or you live on a sheep farm or something, you shouldn't really be getting anything on your dog. Your dog doesn't need prevention if your dog isn't in those environments, strongly in those environments. I don't know if you've ever took one of those capsule things, the liquid that you put around the neck of a dog for flea treatment. I don't know if anyone's ever opened one and by accident it squirted out and ever hit you in the eye. I had that happen to me once years ago when I used one. And oh my word, did it burn my eye. It was like acid going in. And I just thought, and that was the time it was quite controversial about creative grooming and colouring dogs, when it was, and don't try that at home either unless you know what you're doing and products and everything. But we're using like conditioning products which just stain the fur, which are completely harmless to dogs. And there's controversy about that. That's cruel. Well, why? It's a perfectly groomed, healthy dog, but you're putting this acid on your dog's skin that's just like burning. It's actually quite dangerous for some small dogs. Or it's flea prevention. We're not walking around with flea-ridden dogs, and any groomer will tell you, who's got a high volume of dogs going through them, very rarely do you get a dog coming in with fleas on it. Very rarely. Your dogs I've got predominantly white fluffy dogs now, and that really attracts fleas. Fleas love a white fluffy fur, and my dogs aren't pristinely groomed. A lot of my dogs are overdue grooming, look like tramps. They hang around in the garden and stuff. I do not have problems with fleas, never had in the 14 years I've owned dogs. I think Milan got fleas once, and that was because she was playing football with a hedgehog. I wasn't encouraging it, I didn't know. But all this stuff is just so unnecessary in my opinion. But the cost is the problem at the moment. And somebody, a customer of mine, is going to be charged extra on top of her stuff that she gets. I don't know if she gets the dog to pop pills or puts liquid on it, but she's being charged extra for a consultation rather than being able to just renew this stuff that she's buying. And it's unnecessary and unfair cost, and I don't think it's worth it. However, that's just my opinion. It's not just my opinion, it's years and years and years of experience. It's actually the opinion of quite a lot of experts and people. And I don't like seeing unnecessary costs. I know a lot of the corporate vets have got quotas to fill, and I suspect that's why there's all this unnecessary cost going on now. I went myself recently to a vet, and had to have a quick checkup on something which took all of 5 minutes, and that was £60 to walk in the door. And I understand a professional, given a professional opinion, has got a certain price point, but there comes a point where it's quite over the top, actually. And I think it's going to cause a problem. I think it's going to cause a problem where people just aren't going to be getting necessary things done with their dogs because of all this excess cost. I've never believed in insurance before, because obviously for my business I do, but for privately I'm talking about, I've never agreed with insurance because I'd rather put the money away aside every month and then just pay as I go. But then I guess that I'm not spending unnecessary amounts of money on my dog because I can do a lot of my own first aid should I need it. And I'm not investing into all these extra scans and potions and lotions that are just not needed and sometimes harmful. I think it's unnecessary. I'm getting a really small dog spayed soon. And it's been a few years since I've had a dog spayed, but not that long. She's having a little lump removed as well. And the bill's coming to over £1,000. I mean, you used to be able to do quite a technical operation on a St. Bernard for that. And I'm not talking about that long ago either. I kind of bit my tongue and kept my opinion and my mouth shut when I was told about the bill, because I really like the vet that's doing the work. And there's very few vets that I like or agree with. I'm never ever going to mention names because I'm not into all that. I'm not into bashing people or companies. You'll never know who I'm talking about. But I actually left. I joined a vet when I moved, and I left. There were so many red flags, so much bad advice, and so many things that were done wrong that I thought, oh, this is not the vet for me. You know, like just, again, annual jabs. They used a big needle, blood started spurting out of the dog. Now, I know that's not a problem. And the vet nurse was standing there convincing me, oh, it's not a problem, don't worry, it's only a little hole, blah, blah, blah. I know about stuff like that. So, to another person who's not used to that, they would have had freaked about it. But I knew it wasn't a problem. Could be a problem if it got infected. Still really need to know what you're doing. But I know, completely unnecessary. They can use rabbit needles where they don't even feel them going in for their annual jabs. Absolutely no need for them to use this big old needle to put the annual jabs on. So that was a big red flag for me. Things like being told that my, at the time, 12-year-old greyhound could do with being put out to have her teeth descaled. Well, she had been put out a few years prior to that. Rescue greyhound, rotting teeth when I got her, and she had all of her teeth removed, barring a few canines which had to be there to construct the jaw and keep the jaw together. If you remove them, the jaw will collapse. And so she had an expert take her rotting teeth out then. 12's too old for a greyhound to be put out, despite what they might want to tell you that. You might believe them. There might be vets on here going, oh no, it's absolutely fine. And I'm not really interested in your opinion. My 12-year-old greyhounds wouldn't get put out. And she was dead in 2 weeks after that conversation because she actually had cancer. So I'm glad that I didn't listen to that particular vet and have her put out, because she probably wouldn't have come out of the anaesthetic. So yeah, red flags at that vet. I leave and I'm like, what do I do? Because the only vet I like is, I think, 352 miles away, and it's the only vet that's ever operated on any of my dogs. And so I'm looking for the next best thing, who's a really good surgeon, and one of those who will not operate first, will try natural methods first and operate is last resort. These dogs are having more operations than Michael Jackson. I don't understand it. It's just bloody crazy. So I found a great vet, really like her. I believe in her surgery, and so I'm going to keep my mouth shut about the bill, because it's not her driving it anyway. It's, it's others who, they're governed by bills and stuff like that. But it does get a little bit much when you're standing there and it's, that'll be 1,000, that'll be 50, another 60, 150, 170. Do I look like the head of a cartel drug operation? I don't earn that sort of money. I just keep churning it out. You know, it's bloody crazy. So yeah, do I invest in money to pay for all this stuff, all this flea and tick stuff? No, I don't. But even if it was free, I still personally wouldn't, because I feel that the stuff's unnecessary. If the problem's there, treat it. But the problems shouldn't be there in the first place. If your dog's caked in fleas and ticks and got worms, churning out worms, you really need to sort out how your dog's living if that's the case. So with that, we need to address that, not just keep plying it with stuff, you know. Yes, your dog may puppies get worms sometimes. Your dog may get a flea or tick along the way in life, but I mean, this stuff's just bloody crazy. That's just my opinion.